Okay, so 24. What diabetic medications can precipitate ketoacidosis? SGLT2 inhibitors can precipitate ketoacidosis. Um, just FYI, do not laugh at chronic pain syndrome. Thoroughly investigate it. If you have a patient with a headache, altered mental status, metabolic acidosis, and flushing, what should be at the top of your differential? Cyanide toxicity. Patient with headache, altered mental status, metabolic acidosis, and flushing should be concerned for cyanide toxicity. Non-symptomatic pituitary adenomas. Do you need surgery or can you follow them up? Right, just follow up. What do you use to treat chronic bacterial prostatitis, uh, ciprofloxacin, and how long would that be for? 6 weeks. If a child comes to your pediatric clinic and they keep having persistent watery diarrhea, what should you remove from their diet for the most part? You should remove fruit juice from their diet. The standard deviation of a normal distribution is what for the first standard deviation, second standard deviation, and third standard deviation? Well, the first would be 68%, second 95%, and third 99.7. Okay, a group of study participants are followed over time to observe for disease development in prospective cohort studies. Is that true or false? That's true. A group of study participants are followed over time to observe for disease development in prospective cohort studies. K9. Primary prevention happens before a patient is deceased. Yeah, that is definitely true. Now tell me this. What is the recommended caloric intake for a patient with a GI tube? 30 kcals per kilogram per day and 1 gram per kilogram of protein is ideal, right? 30 kilocalories per kilogram per day and 1 gram per kilogram of protein. How do you calculate the positive likelihood ratio? So the positive likelihood ratio is equal to sensitivity divided by 1 minus the specificity. If your female patient complains of a low BMI, hypoestrogenism, and amenorrhea, that is a functional hypothalamic amenorrhea, should be on your differential. Okay, keep that in mind. Now, if you have a patient with a history of thoracic radiation therapy with cardiac symptoms, what should be checked regarding their heart? Check for radiation cardiotoxicity. Any patient with thoracic radiation should be checked for radiation cardiotoxicity at some point. All right, moving on. If you suspect your patient has a pneumothorax, what sort of imaging should be done at the bedside? A bedside ultrasound should be performed if you suspect a pneumothorax. In general, patients with a BCR-ABL translocation associated chronic myeloid leukemia should be treated with what sort of medication class? Tyrosine kinase inhibitors, right? Tyrosine kinase inhibitors for a patient with BCR-ABL translocation associated CML. Now, patients with congestive heart failure, sepsis, alcohol abuse, hepatic dysfunction, and renal insufficiency are contraindicated from taking what diabetic medication that starts with an M? Metformin, right? Patients with congestive heart failure, sepsis, alcohol abuse, hepatic dysfunction, and renal insufficiency are contraindicated from taking metformin. Now, elderly patients are at risk of polypharmacy. We know that, right? So, what is a common finding with elderly patients that have polypharmacy? Orthostatic hypotension, right? If you're looking at a graph of confidence intervals and they do not overlap, what does that indicate? Clinically significant or not significant? It indicates clinical significance, right? Or I should say statistical significance if the confidence intervals do not overlap. If you suspect a patient that is at risk or has HIV, at risk for HIV, what sort of triple regimen should you initiate? You should initiate a triple drug antiretroviral therapy, right? Now, if you have a patient with a borderline personality disorder, uh, they might present with what sort of um, personality traits for the most part? Right, they'll be having unstable relationships and have mood instability on a test. How is borderline personality disorder best initially managed? Borderline personality disorder is best initially managed with dialectical behavior therapy. Autoimmune, non-scarring hair loss should be suspected in a patient with a well-demarcated, circumscribed area of hair loss. And what do we call that? AA, alopecia areata. Now, benign things such as urinary retention can cause transient elevations in what sort of antigen? In the prostate-specific antigen, right? Benign things such as urinary retention can cause transient elevations in prostate-specific antigen. If a patient often presents to the ER setting with nausea and vomiting and tachypnea and respiratory alkalosis and lactic acidosis and hyperthermia and altered mental status, what toxicity should be on the differential? Salicylate toxicity, right? A patient that's in the ER, nausea, vomiting, tachypnic respiratory alkalosis, and lactic acidosis that is hyperthermic and has an altered mental status, you should think of salicylate toxicity. To treat salicylate toxicity, what should you give within 2 hours of the, act of overdosing? You should give activated charcoal. If it's longer than that 2 hours, by the way, you should consider dialysis. So, DALYs or QALYs are used to measure the burden of a disease for an individual or population. We know that. It's obvious. Um, with tuberculosis meningitis, would you expect increased or decreased leukocytes in the CSF? Increased leukocytes, right? Leukocytes in the CSF will be elevated if a patient has tuberculosis meningitis. What is the criteria to stratify patients with community-acquired pneumonia um, to see if they need to be hospitalized or not? Well, one of them is the curb 65, and that's the one that you should have in your prefrontal cortex ready to say at any moment. Patients on carbamazepine should use CBC monitored. Sorry, patients on carbamazepine should have their CBC monitored for what sort of condition? For neutropenia or bone marrow suppression, right? If you're on carbamazepine, you should get those CBCs periodically. What is a frequent cause of withdrawal and isolation in the elderly regarding to their senses. Presbycusis, right? That age-related hearing loss. If a patient that had a myocardial infarction approximately 3 to 5 days ago with pleuritic chest pain and pericardial friction rub, what should be at the top of your differential? Acute pericarditis, right? What is a over-the-counter medication used to treat um, in peri-infarction pericarditis? Okay, high-dose aspirin, right? Sure. And patients status post myocardial infarction with low risk of developing cardiovascular complications can initiate or resume sexual activity soon after a myocardial infarction. Is that true? Yes, that is definitely true. Patients status post myocardial infarction with low risk of developing cardiovascular complications can initiate or resume sexual activity soon after a myocardial infarction. Lithium-induced hypothyroidism can be treated with what medication? With levothyroxine. And it does not necessitate de-seeing lithium, right? You don't need to stop the lithium. Is it okay to give varenicline to a person that wants to stop smoking with a seizure history? No, it is definitely not. Do not give varenicline to a person that wants to stop smoking but has a seizure history. What would you give those patients instead? Bupropion, right? You give them bupropion. Um, FYI, valproate is known to cause birth defects. Keep that in your mental. Now, if a kid at your pediatric clinic swallows a low-risk item like a coin, what should you do? Just follow up. Just follow up, get a repeat x-ray at some point. Eventually, if it's a low-risk item, that's the key. They'll poop it out. It'll be in that little poop poop. If you have a child with a slipped capital femoral epiphysis, does that require immediate surgical intervention? Yep. Slipped capital femoral epiphysis requires immediate surgical pinning. And if you have a patient with an acute uterine bleeding, can that be treated with combination oral contraceptives containing high-dose estrogen, which stabilizes the endometrium and stops the bleeding? Yep.